Doctor, my friend is coughing up blood. Can it be lung cancer? When should one see the doctor?
Coughing up blood is a very serious matter and it needs to be investigated. So, any quantity of blood in your sputum has to be evaluated. It is dangerous sign, but it does not mean it is cancer. Only about 20 to 25% of them could be cancer. There are many other diseases which lead to blood in the sputum. There are things like tuberculosis, TB. There are things like bronchiectasis, and there are a list of lot of diseases which can lead to blood in the sputum. But having said that, it doesn't mean that you sit at home when that happens. Any quantity of blood requires that you go to a doctor or to an emergency facility to evaluate it further, because if you start bleeding more, you may end up drowning in your own blood. So that should be completely avoided. So the first thing to do is to go to an emergency. If it is more than a teaspoon of blood that is there in the sputum, go to the emergency of a hospital. Try to get a diagnosis and treat it. It can be lung cancer, but it is not always lung cancer. So if it is lung cancer, further evaluation of the disease or the condition will give us the diagnosis. There are things to be done after that, like biopsy, a CT scan, and there are many other things which need to be done to reach a diagnosis and treat the condition appropriately.
So coughing of blood is an abnormal symptom. It can be due to many causes, including a simple lower respiratory tract infection or a laryngitis, or it could also be a symptom of lung cancer. So coughing up of blood is an abnormal symptom and you need to consult a doctor always whenever you have this symptom. So this symptom can be serious, especially in smokers who are more prone to lung cancer. So those patients have to seriously consider about meeting a clinician, and if there is a tumor detected, then they have to meet an oncologist. So coughing up of blood, if it is related to any other cause, it should usually settle within 2 weeks. In case it doesn't settle within 2 weeks, then we should evaluate it more to find out the exact cause for it and to go to the root cause. If blood is noted in your cough and it doesn't settle in 2 to 4 weeks, then probably you should consult your doctor and get it evaluated further to find out if it is related to underlying lung tumor.